Trade Union Solidarity plans to legally challenge the passing of the National Health Insurance Bill by the National Assembly. The Health Department says it welcomes the latest developments. However, other stakeholders are concerned about how the NHI will operate in South Africa. Earlier, we spoke to Deputy Health Minister Dr. Sibongiseni Dhlomo.
The starting point is that this is an initiative of the World Health Organization. Now, when you are actually having challenges in your country, you go to the World Health Organization and say, guide us, tell us what actually should be happening here. So the former DG of WHO, Dr. Margaret Chan, was a strong advocate of the universal health coverage in all countries in Africa, because she called this an equalizer, that a gardener can be in the same place. You look into the health and life of a gardener just as good as that of a boss. So you actually say health becomes a public good for all citizens. It should not be available to those who can afford, but all citizens of that country. And now we are compelled in our country by the Constitution, Section 27, that says all citizens should have actually quality good health. And it then goes on to say the state has an obligation to make sure that those citizens do get the quality health care. So we are actually following the guide that is actually in from the whole WHO and what other countries have since done in their various communities.
All right, so let's walk quite quickly then, Deputy Minister, through some very important issues. Concerns raised by MPs, and we were in conversation with Solidarity Trade Union earlier on, include fears of a skills flight by medical practitioners and organizations. Some commentators have said this will collapse the healthcare system. What is your response to these fears?
Because people are looking into, let me look into the collapse, because they are looking into, if you have got an advanced cancer and we have to take you through a health system, you really have to go through what we call chemotherapy, radiotherapy, and also do surgery. But if we were to pick you up at the very elementary age of going out into the villages and screen people, that's what we actually learn from countries that are doing that. You go out there and primarily focus on primary health care, pick up illnesses before they can even start or at their elementary age. You then can save quite a lot, that not all our citizens will then have to need to be treated for severe hypertension, for severe diabetes and cancer. You would have picked it up at a very elementary age. And for that, then you use a small amount of money to do just that. You massify that type of primary health care in the country, and like what countries have done, and therefore you reduce huge expenditure. We are a country that relies on hospice-centric. You wait for people to get ill and get so ill that they come to our hospitals for major operations. This time around, we would want to reorientate our mindset and the country to go primary health care route and focus on going out and massify screening of citizens before they get ill. Number two, other countries have done this. If we are scared of there will be so many people who leave us, they will have to indicate which countries are they visiting or going to actually relocate to. Because this is a move. I started by saying this is a World Health Organization sort of directive. All countries are actually starting this way. Now, which country will they move to and actually sell their labor if they withdraw from our country? They will find that going to Canada, going to Thailand, going to US, going to United Kingdom, they will find that this system is already starting up and already getting matured in those countries. So all countries in the world are going the universal health coverage. It's at different stages of where we are in that regard.
So a quick response on this then. You don't believe, you believe it's more of a threat than a real reality that South Africa would face, a brain drain?
Some countries face the brain. Some of the countries did face a brain drain, but then they had to rebuild. Now, you can't have a threat to such an extent that you don't trust a noble program because there's a threat. You always have to start from scratch. I could count more than 5 countries that had this route, and they had to actually start from scratch, or they had to live with what they have when there were people who significantly said, look, we can't live and we are going else. We have quite a number of countries in the world that are going the same route. So every healthcare worker will find some semblance of universal health coverage in whatever countries that we are looking into in the world.
So let's talk about the money. We'll come to capacity building in just a moment, but let's talk about the money and the funding for this. Where is it coming from?
It will come from some of us in the country. For example, I would probably know, you may not be, probably are aware that I do, like many other citizens in our country, are subsidized for our medical aid. It doesn't subsidize my gardener and my domestic worker, but I'm privileged to have that. Now, why do we have that 25 billion reserved for the few and not advantaging the rest of the country? So you need to rearrange as a starting point. You say, no, rearrange already what government is spending on some of us on health, and therefore top up with whatever that will be advised by the National Treasury and the support. But all we are saying that the program is that we need to actually create a fund, probably pulling in, starting from what we already have within our national fiscus allocated to me and you and those who are benefiting through their subsidy, and then top up there to make sure that the money is stretched bigger and can actually accommodate me, you, and my grandmother and my domestic worker.
Okay.
So the pulling of funds will then make it easier for the buyer, one buyer, the universal buyer, to be able to really make economies of scales and buy bulk at a very low price, and therefore be able to save going forward. But those are nitty-gritties that will also be supported by the discussion that is going to happen between the Minister of Health and the Minister of the Treasury.
It sounds like a very big piece of the puzzle, Deputy Minister, that's not finalized. And again, it's a little bit worrisome that we're going to have that conversation on the detail a little bit later. But just to stay with the example that you quoted, people will say, and in fact, I want to talk about this, when we look at the white paper, that nearly half of all health spending in South Africa benefits 16% of the population, the 84% rely on what is left. So that's why there's this concentration of resources in the private sector. But people on private medical aids are paying out of their own pockets. So are you saying, let's say I'm spending 10,000 Rand a month on medical aid because it's for me and maybe my children and my mom. What happens to that money, notwithstanding the subsidies that you say would then be pooled? And I'm assuming these are subsidies that companies normally give to their employees. So that's the one side. But the money that I'm physically taking out of my pocket, if I'm not subsidized, am I going to still be expected to take money out? And how will that threshold be calculated per person to give to this national pot of money and funding?
There has been this issue of threat to the medical aid, which the National Health Insurance is not actually having. You will continue with your medical aid if you so desire, because you probably do not have as yet confidence on the processes that you are putting in place. But once there's a maturity of the National Health Insurance program, and most people will probably say, I would then continue with this program and not actually be able to then have my medical aid. But the first part is that you continue to have medical aid, but you still be expected to support this program for the benefit of those who are around you, who are your other extended families who do not benefit from your medical aid of you and yourself and your children. There will be your domestic worker, there will be your grandmother. I mean, many times, when there's been an accident on the road, the people will come and say, do you or do you not have a medical aid? For those who do have a medical aid, they will be picked up and go to another center. For those who don't have medical aid, they lie down on that street and wait for some other processes. So there will be an expectation of me over and above my medical aid that I need to protect to then continue to support this other national funding that is going to come in to support the rest of the country.
Okay, so I need you again to explain it to me like I'm in primary school. So I pay my taxes, and part of that tax in the common course are given and allocated by Treasury and the Finance Minister to health. Then I pay for my medical aid, which, as you say, once there's maturity, and I believe in the NHI, I might, get rid of that and just only want to be a part of the NHI. On top of those two expenses, there'll be a separate tax and contribution towards the NHI?
Look, the first thing, ma'am, is that we are actually yesterday passed a bill which we need the support from the NCOP to say there should be a universal health coverage in the country that covers all citizens, including those who are actually asylum seekers, and all. That's the one part. Now, the funding for that is going to be of a collective fund that is going to come in either through taxes or through national the subsidy and the rest. And if there is to be that type of an issue, that is a part that has to be then a need of that to be concretized and finalized by. But you have to separate these two, of actually making an agreement in principle that there shall be a universal health coverage in the country funded through the process of pulling the funds together.
Yeah.
Now, there needs to be an expertise that comes outside us as health activists that says the money is going to be assembled in this way or the other way. Other countries have gone it. There are models that you can learn from various other countries. I would not want to preempt and say this is how it will be done, because we need the expertise and support from the finances people to put that in place.